I would venture to say that most LGBTQ people don't feel safe when meeting with a provider for the first time. Even when meeting with a provider that says that they're an ally online. And we know that there's a big difference too between being an ally and being a provider that's part of the community.
2.5 years ago, when things were happening in this country around COVID and racial and social justice issues, the issue around diversity, equity, and inclusion in health and benefits became a huge issue.
And my work is focused on depression in older adults and sort of finding the best ways to identify depression and treat it or manage it depending on the setting.
My passions for who I wanted to serve began to grow because I saw, as I became a part of the LGBTQ community or realized that I saw that there was such a need for providers there, and I realized that that was something I'd been passionate about this whole time, and then everything just kind of fell into place serendipitously.
A lot of the symptoms of depression can overlap with symptoms of other medical problems, so it takes a lot of kind of self-awareness to know that somebody might be experiencing a depression.
We have one another, no matter what. And it's more important than ever that we spark those connections between each other and lean in to these uncomfortable spaces instead of leaning back.
We did a review of benefit plan design for this one employer who the benefit leader was struggling, like, what do I do? And how do I go about this? And at the end of it, she's like, you gave me hope. You gave me hope that I can do something to support my diverse workforce. And that just, you can tell, like, it's really moving, like to give somebody hope.
I think one of the biggest things is remembering the strength in the community when we come together and organize, both online and in person.
My God, look at everything we've come through. Like, look how much stronger we are. We're here celebrating Pride after COVID, after this decision, and I think, Pride started as a revolution. Pride started as hope, and that was all we had literally at the beginning was hope. And even if that's all we have left, that's, I think, what's going to carry us through to whatever comes next.
Just not being connected to other people is a real risk factor for feeling depressed, other mental health problems, and unfortunately death by suicide.
We really saw tremendous disparity in prevalence, so much higher rate of particularly the LGBTQ youth during COVID feeling suicidal. So 46% of that youth community contemplated suicide over the past 2 years.
There's a lot of tension, there's a lot of fear, and that means it's that much more important that we hold to our values and be there every day to serve the people that we serve.
A lot of us don't have families that are supportive. A lot of us don't have people besides our community, and being in person, being together is such a just critical part of mental health and part of the community and feeling like you have a place. So it was really like fracturing a family.
I think both in mental health and in physical health, if somebody doesn't feel safe and comfortable being out to a provider, the provider's not going to know how to help them. They're not going to know what medications to use. I'm thinking of things like PrEP and STD and STI screening. It can look really different for people in the LGBT community.
Today is about showing up in a different way. I mean, I'm just here as a support person, but I couldn't be more honored or more thrilled. It's a great way to facilitate something to get people to listen to something that they need to know more about.
Good afternoon. It's so good to see all these faces here, right? This is, thank you. Wonderful to be together today. I'm Denise Gianvalvo, Director of Purchaser Strategies with the Washington Health Alliance, and I have here with me
Jill Salvino, director of this film.
Just a small little role that she's played and today actually happening.
And I'd rather be sitting there.
So how about sharing with us how this came about?
So the film started as a conversation a friend and I were having about a different friend who was gay. And I said, oh, he's not gay like Michael, he's gay like Pete. And she instantly knew what I was talking about. So we got into this discussion about how our perceptions of gays and how people have changed over the years, and that there's no boxes anymore. And I decided to start talking about that. So I said, well, if we're going to interview, gay men, let's do lesbians, and let's do queers, and let's do trans, and then like the spectrum of people emerged before us. And I said, well, let's talk to parents about when their kids came out 40 years ago, what that looked like and what their fears were for their children versus parents of kids that came out recently. And let's take a look at labels and names and boxes and see how people feel about that. And the one interesting fact that we found across the board was that there is no box you can put anyone into, and that everybody's the same, because at the end of the day, all everybody wants is to not be judged and to be loved.
Such a beautiful message, right? So, in a moment, you're going to experience this film or excerpts from it, and I think you'll be agreeing with those that reviewed it. Jill was very successful at creating a safe place. So how'd you do that?
So for me, no matter what I'm shooting, the most important thing, I'm so loud, is creating a safe space on the set. So from the moment somebody walks in, like the first person they meet is the assistant producer or the producer, and you have grips and cameramen and sound people and makeup. And so they spend an hour and a half in makeup. And it's always really important for me that somebody starts to feel safe, because how are they going to sit in front of two cameras and all of these people and talk about intimate details of their lives? So I think it's come full circle, because for me, making the film was about having that conversation. And today, I think we're here to talk about safe spaces and health and wellness. And I find when I'm interviewing people, if they feel safe and I create a boundary for them and they know I'm not going to encroach it, that they will come towards me. So I think what you'll find when you watch the movie is that people really did feel safe. So I thank the Alliance today for starting this conversation and bringing it into the health and wellness arena.
Yeah, thank you. Yeah, we're so pleased to be able to do this. And, at the Alliance, we've built ourselves off of trust. We've worked with multiple stakeholders. We're a membership, not-for-profit, of multi-stakeholders in the healthcare field, supporters of healthcare, consultants for healthcare. And we've been successful because we do the same. We create that safe place for everyone to come together and work together to improve the quality of care that's being delivered in Washington State, and also affordability and access, right? So we're talking about creating equity, and it can't be equitable if everyone doesn't have access. So again, thank you for being here today. We are, if we could just switch so we can thank our sponsors. Yeah. So big thanks to Genentech for their support for today. And with additional support from Aetna Community Health Plan of Washington, Kaiser Permanente, Neighbor Care Health, Optum, Milliman MedInsight, City of Seattle. We have Virginia Mason Franciscan Health, Washington State Healthcare Authority also. And for those of you here representing those organizations, thank you for joining us on a gorgeous Saturday that we haven't had in a while, right? So really appreciate you choosing to be here. And everyone that's online, thank you so much for choosing to be here today. So we'll start with our first clip about identity.
I label myself as a bisexual woman.
I label myself as a trans female. I picture myself as a heterosexual female.
What, in sexual orientation? I never really liked labels, but I guess you can say, I guess I fall within the lines of bisexual.
If I had to, I'll
I would say bisexual.
I'm attracted mostly to men, though.
Pansexual, queer.
I label myself as a spiritual, grounded, good person that, like, just, I don't know, I guess that's it. You know, I'm gay, and,
I'm technically straight, but my boyfriend, he's transgender, so I just have to accept that.
How do I label myself?
I identify as a straight female, but I say that I'm blessed to be a gay man born in a female body. So, one of the lucky ones.
I'm a gay man, yeah.
I guess I label myself as a straight man.
At the base of like your human existence, I think that everyone is pansexual. I feel like you can't really help who you're attracted to, and I think you should just embrace that.
It's so interesting to watch the outrage, how radical people are, and the insistence on, you know, labels and names and rights and where we fit in the world.
It makes sense just to accept people the way they are and not to try to find a label for them.
Labels have become exceedingly important for my generation. When a lot of queer identities were labeled, it was society labeling us. And now we're claiming ownership of the language we use to differentiate between gender identity and biological sex and how those things intersect.
Except to friends who I'd known before, I never felt the need to declare myself as anything.
I'm transgender, gender nonconforming, and I have a female sort of mind, the traditional female. So I have an attraction for straight men. That's all I've ever dated.
I'm not happy about labels. I mean, I accept them. I accept however you want to call yourself. I would certainly call myself gay now, a lesbian, but I was not always, even though I was always attracted to women, I was very much attracted to men. I didn't change teams till I was 30. And I resisted labeling myself for a long time, especially publicly.
I love my label. I'm a lesbian, I'm a gold star lesbian. I personally have no problem with labels if you want to give them to yourself. I have a problem with other people labeling other people, but especially as long as other people use my label against me, then I will use it proudly. I've always been a lesbian, and I'm like on the spectrum. I'm way there. There's nothing in the middle.
I'm on, you know, a little bit more towards the spectrum of not wanting a label. I've always felt that way about why should we need to be labeled, but that's in the perfect world.
I am Table McSmith. I identify as a trans male. I can? Okay. Should I? Should I turn around? Like, oh, hey. You want me to do it again? Okay.
Mark.
You know, I probably realized I was attracted to women before I realized that I really was innerly male. You know, I think that was the first feeling. As a kid, I was always misgendered and seen as male. And when that happened, I always thought I was kind of getting caught, and so it was exciting, but also I felt really guilty.
There's all these possibilities when you're young, and you're like, I could be this, I could be that, I could be anything. And then as you get to know yourself more and trust yourself more and go, actually, this is the truth about me. I need to do this. I want this. I like this, actually.
And so now there's been this shift where gender's on the table and people understand that there are more than just two options, male and female.
We're all on the spectrum, and to think that the spectrum just is a three-part spectrum or a two-part spectrum is a misnomer. We're fluid. We bounce back and forth.
I don't like labels because we can put people in a box. It means we no longer need to listen to them because they are transgender, they are gay, they are conservative, they're liberal, they're progressive, whatever word you want to toss out there.
There are all these different labels that people try to fit people in a category, and we're learning as a globe that we are not identifiable. We're not puttable in that category. And sometimes people who fall between fall through those cracks, and they can't find the identity that they desire.
When you try to tell someone that they are something that they're not, it can be so damaging. People get depressed, people get suicidal.
So I guess when you think about kids and teens and young adults. They are so fluid in everything, and they've been exposed to so much already in their life that they're not really fazed by it all.
My daughter and her group of friends, you know, I think she has as many gay, lesbian, trans friends as she does straight friends. And I don't even think many of her generation identify as straight.
I don't really love labels all that much. I just love people. I'm more of just a people person. I happen to love women. That's who I am. Well, I love a woman. I don't love multiple women. I love multiple women, but in a different... I love her. Okay, let's start over.
It's okay, honey.
No,
That's okay.
But I just, you know, I think labels can create silos for people, and you know, we're who we are. I love you if you're transgender, if you're, I just call myself gay. You know, you can call me a lesbian, you can call me gay. I don't care. I'm just Madonna, and I love Robin. And for me, if a label works for you to use, then it's great. But I just don't like it all that much.
I get asked both from within the LGBT community and outside the LGBT community my sexual orientation, which really is nobody's business but my own. I understand the confusion. I have a great business partner who I love dearly. I just have I've never had that sexual desire.
I'm 100% gay. I've never been with a woman. Yeah, it's never happened. I think when I was really young as a teenager, I was too shy to even experiment, but I knew what I was. I knew I liked guys when I was, as long as I can remember, like 9, 10, 11, 12 years old.
So someone like me dating someone who is gay, it doesn't work because we're looking for different things. I'm looking for what my dad is to my mom, you know, because that's the type of male that I would prefer to have in my life, and those are the types I've always dated.
So I started to date women in college, and it was very tough because I don't identify, I never did as a lesbian, but I very much loved to date women. And I went through several relationships, and they all kind of ended, and I didn't have the ability to be in a solid relationship because I wasn't solidly who I was yet.
But it's interesting how everybody, almost to the person, wants to know where you're at on the spectrum and where you fall within that community and within that group of people.
I use the term queer to describe myself in terms of sexuality because it leaves room for my gender being not male and not female. Like if I say I'm gay, most people would think, oh, that's a man. If I say I'm a lesbian, people would think, oh, that person's a woman.
Being gay is wrapped up in being queer, but being queer also kind of cause us to pause and think about intersections between gender identity and sexual orientation.
I treat individuals and couples in all realms of sexuality, some about dysfunction, some about gender, nature versus nurture. As a clinician, I can tell you, it's really about biology. And it really has to do with how you move and groove your biology in your social world. But again, most of the time, you can fight it, but you have to be really true to who you are because your biology will lead you there.
Intersexed is really what a lot of people called hermaphrodism or hermaphrodite. Now, the big thing about both sexes is you have your male, you have your female, but you have this wide scope in between of people that are born, you know, in between this situation. It's not always male, female, black or white. I mean, there's a plethora of that middle gray area.
We are born who we are sexually. And sexuality is on a continuum. Where you are on the spectrum, the continuum of gay, bisexual, and straight, has to do mostly with genetics.
I have been confused to be transgender. Some people have said to me, we heard you were once a man. I've heard people say to me, I understand that you're going through a sex change. Why would you want to become a man? You know, we heard you were a lesbian. And what I try to explain to people is, if this is what you want to know from me, you should probably get to know me better as a person or an individual first. And then let's talk as we go along instead of hitting me with that.
There's a great example that I have from college, and that's a fraternity brother. He never met a gay person, ever. It certainly wasn't a part of his growing up. That's a fair way to say it. Not something he saw and experienced, and not something he really accepted, and he admits that. He says, I was a total homophobe, and as a result of how our relationship started, he had no choice but to get to know me, because that's how the process went with the fraternity, and having to pledge and spend this amount of time together. When we talk about that, that means the world to me, because that's a firsthand example of someone who got to know who I am first before they got to know what I am.
How's that for honesty? So I invite our panel up here now. Our wonderfully talented panelists here. As you can see up on the screen, we have Slido.com that we're using for questions to be submitted. So our audience, and any comments you may have, you can also submit through that. So if you'll take out your phones, go to your browser and do Slido.com. And when you get there, it'll ask you for a code and just type in shades. It doesn't have to be in uppercase. It could be lowercase too. It'll take it either way. And it'll immediately open for you and allow you to submit questions. So you can do that throughout the program, and I will keep an eye on those and ask them on your behalf. I leave this now to Michael Garrett to kick off this panel.
Thanks. Can you hear me? Ooh, there we go. Is it on?
Why don't you take your mask? No?
What's that?
Yeah. There we go. There's that pretty face.
Great. First of all, I'd like to thank the Washington Health Alliance and Nancy Gento and her team for having this event. This is really great, and thank all of you for coming out on a nice sunny day to attend this. This is great, and hopefully this is just the first step in a journey around incorporating diversity, equity, and inclusion into the Washington Health Alliance work that they've been doing such great work for a really long time. So thank the Alliance and also all of the sponsors for putting your money where your mouth is in terms of supporting diversity, equity, and inclusion. Really appreciate it. So I think we're going to first start with maybe giving a little background about each of us. And I'm going to start with, you already introduced yourself, Jill?
Yes.
Okay. We'll start here.
I'll go first. My name's Tom Parsons. I use he, him pronouns. I'm the founder of and a mental health therapist at Optimism Counseling. We're a group practice primarily serving the LGBTQ community. And if the hard work pays off, I'll also be one of the founding members of a new nonprofit queer and trans therapy collective.
Good for you.
Great, thanks. Michael Garrett, I use he, him, his pronouns. I'm a principal in the Total Health Management Specialty Practice at Mercer, which is a global human resources consulting firm, where I do work around value-based care and diversity, equity, inclusion in health and benefits. I also need to say that I am a member of the Consumer Education Committee with the Washington Health Alliance, as well as other community events. For example, a work group with the BRE Collaborative here in Washington State on social needs. My background is I have a master's degree in clinical psychology, and I'm board certified in case management and patient advocacy, and have been doing work around diversity, equity, inclusion, and health and benefits for probably about 5 years. So really pleased to be here today. And I'm the moderator today. These folks will be doing the talking here. So go ahead.
Hi, my name is Liz Landry. I use she, her pronouns. I'm a mental health therapist at Optimism as well. I have a background in clinical social work, and I work specifically with folks who have religious trauma, and especially as it relates to LGBTQ identities.
Hi, everybody. My name is Patrick Raue. I use he, him pronouns. I'm a clinical psychologist and professor at the University of Washington, and I work at the AIM Center, which is devoted to helping primary care clinics and other healthcare systems do better at integrating mental health services to kind of increase access and provide more acceptable and evidence-based treatments. I also do research, and my focus is on older adults with depression and kind of investigating the best ways to identify and manage depression depending on the setting. And I'll be talking later about my work with Gen Pride, which serves the LGBT older adult community.
Hi, my name is Brian Armbrust. I am the Administrative Director of Sound, which is a whole healthcare organization in the Salish Sea area. My background is actually music, but I've been through many walks in life and have landed here. I'm very passionate about nonprofit work and about the work that we do at Sound, serving primarily Medicaid clients, so the folks that often get overlooked in our healthcare system. So I'm really excited to be here today and talk about the intersection of queer identities and healthcare.
Great. So although we just had a great clip, I want to make sure we all get really grounded. And so I wonder if we can talk a little bit to make sure that everyone understands sexual orientation, gender identity, and one of the areas that was not covered was gender expression. So I wonder if you all can chime in and kind of talk about that quickly. Whoever wants to start.
I can hop in for a second.
Sure. Sure.
So my personal journey, honestly, with gender expression has more recently come into my life. My pronouns are he, they. Sound actually gave me this button. I was really excited about that. But I'm gender expansive. I'm not sure what it means for me yet. I feel a little more they lately because of the way things are going in the world than I do he, but I answer to either one. For me, sexually I identify as queer, but that's also a political label for me. So it's like it's all this great complex intersection. But as far as the gender itself is concerned, I don't believe in binary, and I'm exploring what that means for me as a human. Right, and less academically. I'm actually getting personal with it. So,
great.
Yeah.
Thanks. How about sexual orientation, just to make sure everyone understands?
I can take this one. I think sexual orientation is sometimes just referred to as like who you want to go home with, right? But I think it's also more about who you care for, who you love, like how you want to be loved, what that reciprocal looks like for you. I think the person in the documentary said it really well when she said she was looking for, the dynamic, a specific dynamic. So I think it's who you relate to, how you feel seen, how you feel loved, and exploring what that really means for you and how that can feel fulfilling in your life.
But I think that's fluid as well from everything that I heard. It's like you could be one thing one day and, think about like how kids are now. They're so non-declarative, and which is kind of terrific, and hopefully in 15 years this will be a joke.
Yeah.
Yeah.
Not the producer or the director, but
no.
Yeah. Yeah, and I think, if there's anything you go home with today, and when I give talks about this, the concept of spectrum or continuum keeps being repeated. So whether it's sexual orientation, who you're attracted to, whether it's your identity, who you think of yourself, regardless of, as I say, the body parts, like forget body parts for a second, just what I think of myself, again, on a continuum, and then gender expression. And I think if you're not careful, you can make assumptions about somebody's gender identity based on how they present the world. Or you can make a presumption on their sexual orientation based on how they're dressing. And the other interesting thing, I was just thinking when you were talking about pronouns, there's some people that say, I don't want you to use pronouns with me. It's like, okay, just use my name.
Yeah.
And that's okay too. I think we get really hung up on pronouns, and I do a lot of writing, and it took me a while to kind of accept they, them. People got to get over it. Like, that's just the way it is. They, them can be used for an individual person. And so kind of set aside your writing style guides and accept that this is our new reality. So I'm curious in terms of your work with LGBTQ patients or clients. Talk a little bit about how do you make it inclusive for them in your practice and the work that you do? How do you make being LGBTQ inclusive and safe?
Well, I think inclusivity starts from the very beginning. So the way that we represent our organizations online. And throughout our intake process. So it includes asking questions about sexuality and gender identity, making sure that we know our clients' pronouns. And to me, it's also about sharing our own identities. My identity as a gay man is really important to me, and I also think it's really important to many of my clients. They're not just looking for an LGBTQ ally as a provider, they're looking for somebody that is part of the LGBTQ community. And I have a quick story about why that's important. I was helping a friend find a therapist, and he had reached out to his insurance provider and said, I want to work with an LGBTQ provider. And they referred him to someone, and he sent me the link to their page. It was like, hey, you're a therapist. Can you take a look at this? Let me know what you think. I took a look at it, and it turns out that provider actually provides conversion therapies, which, if you're familiar with it.
Can you describe what conversion therapy is, actually?
Yeah, it's a outdated and disproven attempt at changing or converting somebody's sexual orientation, oftentimes in an attempt to make a gay person straight. It doesn't work. It leads to suicide and other mental health complications. So I shared that with this friend, and then I also reached out to the ethics hotline at the insurance company, and they did a fantastic job immediately reaching out to my friend and also removing this provider from their network. But this is the difference between sharing our identities and then just putting a blanket label out there like LGBTQ specialization. Very different.
That was a horrible story.
Yeah, and conversion therapy has been debunked by every medical, psychological association, and actually has causes physical and psychological harm.
Absolutely.
And so, because I work with employers, one of the things I advocate for is exclude coverage for conversion therapy, so-called conversion therapy, exclude coverage. So I think that's important to connect the dots, because I know the Alliance is multi-stakeholder. I'm making sure, Nancy, we bring all that in, and so there's a place for not only providers, and we'll talk more about what plans and employers and government agencies can do as well.
I have a question from the audience. As we are here the day after becoming a Roe v. Wade generation, how can we expand our view of gender and gynecological services?
I think we have to talk about it. I think one of the things is we have to talk about, what does gender identity mean? Why this is a healthcare issue, actually, more than anything else. But I think we need to not hide it, and we need to talk about it. And even if it's uncomfortable to talk about, when you talk about reproductive health and genitalia and so forth, like that may be uncomfortable, but I think we have to get uncomfortable to address these kind of difficult topics.
Absolutely, yeah. As someone with a uterus on this panel, I think that I'm in a privileged position to be up here talking to you about this, right? I'm also in a privileged position to have access to healthcare in Washington, but I'm from Tennessee, and many of my friends there, many of my family members there do not have the same access, right? And so to think that they're getting a small taste of what it feels like to be, have their rights taken away here and have all of these conversations have to open up. I mean, you don't get any education, like any sex ed, any sexual orientation education at all in the South, right? And to get uncomfortable with talking about this, because it's also uncomfortable to have your rights taken away, right? Like, it's also uncomfortable to be a parent before you're ready. And I think that these are such necessary conversations, and also ones that I think that our community is prepared for, right? Like, we shouldn't have to be, but I think there's resilience in all of us and in this post-COVID world where we've come together, and the fact that you're here today and asking these questions, right? I wish that we didn't have to start this conversation over again, but I think that because we've been through so much as a community and all as individuals sitting here, like, we're ready for it and having the hard conversations and bringing up the topics with the family members that you don't want to, and with the people who are, voicing their opinions. Like, they're giving you a platform to discuss it with them, even if that's not the ideal time or place to do it, right?
That's great. And I love the fact that you brought up access, because I also think about all the state legislation against healthcare for trans individuals, hormone therapies and so forth. And it really comes down to access to healthcare, appropriate healthcare, and getting that legislated, just it's a dangerous, dangerous path you're going down. So thanks for your insights.
So I think this is a good place for us to watch our next segment.
Okay.
And please keep the questions coming in. If your question wasn't asked just now, we will get to it later.
Uh, 10 being completely like gay and 1 being completely straight, I would say like 6 or 7.
I don't know about the number. Like the 1 to 10 seems very specific.
10 being very gay, I'm like an 11.5.
Geez, I don't know. I never thought of that. 5, maybe?
I would say 5, just because I've lived with a woman for 3 years, and we were in a relationship.
I don't. I tend to vacillate back and forth. It kind of depends on where I am. I don't really think about it.
8. Yeah. Yeah. Cool. Yeah.
I am attracted to girls, and I think everyone is bisexual. I just don't understand why it's a big deal.
Like an 8-ish, 9-ish, 10-ish.
I'm gonna say 5.
But my stepbrother is also gay, so my mom calls herself like a walking P-flag advertisement. That's why we know he's an 8, because we've met his brother. Yes, my brother's a 10, for sure.
You know, the process of coming out, in a way, as wonderful as it is that things are better for today's kids, and it's totally wonderful, and we wouldn't want to change it, there was something kind of amazing about being part of this struggle, which is not over. We have a ways to go, but the progress we've made and to get to see it happen has been great.
I knew for certain. I was about 14. I had my first girlfriend at 13, and I thought, no.
I don't think I ever was in. For me, coming out was just a realization. And I didn't know why I wasn't attracted to the girls that my classmates were attracted to. It didn't make any sense to me other than that I wasn't attracted to them.
Around the 3rd grade, I had my very first crush, and it was on a boy, so I knew.
Well, I mean, there were huge, massive, gut-wrenching crushes that were just more confusing and frustrating than anything as I grew up. And then I started to feel like I started to get a clue about it, and I was like, that's what this is. This isn't normal. I'm not like my friends. I like my friends, you know what I mean? Like, or once in a while, I would like a certain person that was just like, you know, too intense, too much, too something, and I couldn't even name it. It just was like this desire to be with that person, and so that was frustrating. But with my pending marriage, I was on a mission. I was like, I must. Now I was really clear about it. No, I have to have sex with a girl before I get married because I just have to make sure I'm not gay.
My mother had this great lucite shoe with a plastic front and a sling back, and she was a 10 narrow, mind you. So I was a man's size 9.5. So they were like my favorite shoe. It was like Cinderella's shoe. So growing up, I used to go downstairs and sneak in the cedar closet and parade around in the lucite shoes. And my mother couldn't figure out how the plastic had stretched out so much when she went to wear them a couple of years later. So I just said, oh, must be the construction of the shoe, Mom. I guess they were inexpensive.
Having a conversation about my sexuality was never a big deal. I don't even remember the conversation I had with my father, to be honest with you. It was like so nonchalant. We were probably in the car, and his response was probably, okay.
I did not come out of the closet until I was 40 years old. That was about 9 years ago. I grew up in a small town in the Midwest and stayed there for college. And I don't think I honestly really had any idea who or what I was until sometime in law school. It was something that kind of dawned on me slowly and with a lot of resistance, and I resisted it kicking and screaming. And it was only when I became a partner at my firm and relocated here that something about the change of scenery or something just snapped and said, that's it, you can't keep going on like this.
I did come out to my mom. It was Easter weekend about, God, almost 30 years ago, I think. And I called my mother up, and I was living with a man who was about 19 years older than me. And we were together for a few years, and I wanted my mom to know, so I told her I was gay, and I was like really worked up over it, about telling her. And what I was thinking about was like my mother thinking about me having sex with another man. That's what actually was going through my mind. So I was able to tell my mom, and she was pretty awesome about it. She said she was awesome and she wasn't awesome. So the first thing she said was, I always knew you were gay. And I was like, oh, really? Well, why didn't you tell me like 10 years ago if you knew I was gay? But then the other thing she said to me was, let's not tell your father.
I was so scared to come out to him. And then my mother, I was always a mama's boy, so I wasn't too nervous about telling her. I knew she would be a little more understanding. And then I finally told my father, and he didn't really understand where I was coming from. He didn't want to believe it. And then my mother, she eventually came around and she accepted it, and she got a chance to meet Richard. And I think that's what really brought both of my parents in. They said, okay, he is an older white guy, but he's actually a nice guy. He's very likable. And they just want me to be happy. And they saw that he made me happy. And so they just jumped on board with that.
I said, Mom, Dad, I have something to tell you. And my dad says, well, what is it? And I said, well, it has to do with my sexuality. And my dad says to me, do you know what you are? I said, well, I'm gay. He says, well, I kind of figured that. And then my mom looked right at me and sighed with relief and says, oh, thank God, I thought you had cancer or something. No, true story. I mean, oh, you're only gay.
But I will say this, a couple of my friends stopped talking to me because I didn't tell them that I was gay. And I told them I couldn't tell them because I was just so scared of how they would react. Think about it. You're in high school and you tell your friends that you're gay, they might look at you and just disown you. So I told them, and a couple of them just stopped talking to me. It's unfortunate because we were best friends for so many years, and then this one little thing just turned them off.
If you meet someone and you fall in love with them, why would you let anything stop you from love? And that's really what it comes down to, regardless of the race, regardless of the religion, regardless of the gender. Why are you going to stop yourself and prevent yourself from feeling love when you're afraid of the party parts? These are party parts. It's a relationship. And again, that's the way my mom raised me. So again, the coming out thing wasn't a big issue. It was, oh, this is my girlfriend. Okay.
I was married for about 10 years when I realized that that I was gay, and that I needed to get out of the marriage and be who I really was. It was tough. My children were young. I have 3 children, and it was a long, hard battle.
Got to get laid before this wedding, which was still like 8-9 months away. So I saw her sitting at the bar. I was like, do you want to go skiing? You know, and so that began this little romance without sex and without, you know, anything. And after work, we would just talk on the phone till 3 in the morning. And she had to work at 8 in the morning. So we had this mad love affair on the phone. And finally, one night, she goes, come over.
The day I came out to my parents, my dad gave me a choice. He said that I could basically be under house arrest and quit work, give up my car, or I could take whatever I could carry and I could leave that night. And I chose to leave. And he gave me a broken laundry basket, and I put as many clothes as I could fit, my school books, and my Les Miserables CD, the first CD I ever bought, and piled into my Plymouth Reliant K car, and I named her Ethel, and left. I didn't have a plan.
I walked into her dark apartment, and, you know, there was like a light on in her bedroom, and I went in there, and she was like laying in bed. I think she was just like either naked or wearing just underwear or something like that, and I was just like, you know, and I was like, I got naked and got in bed with her, and then she like rolled on top of me, and I'll just never forget, like, the first thing I noticed was like her tiny little frame, you know, like, because she's a girl, and I had had sex with a boy at that time. So her tiny little shoulders, like on mine, her little tiny freckled shoulders were just so ridiculously gorgeous to me, and I just finally like you know how it's such a cliche, but it's like I understood what the big deal about sex was. I understood why I was born, why I was alive. I understood that God had meant her for me.
I did come out to my parents. You know, I was raised in a Catholic Italian family, and my dad screamed at me and threw all my clothes on the bed and then asked me what I wanted for dinner. So it was just another night at the house. There was a little bit of hiding that had to happen then, but I didn't do too much of that. I just went to the bars and all of that. And I tended to be involved more in movements where people were trying to make change. So I was more surrounded with people who were like-minded.
1 out of 2,000 people are born this way, both sexes. I believe myself that there's much more. To me, it's just something that doctors believe. You know, I don't think they've even touched the surface of this and don't want to. I was able to make my decision luckily, because my parents, they weren't in a high-income bracket, so the funds weren't there to get me treated right then and there, as the doctors would call it. And the other thing is I come from out in the middle of nowhere, let's say that, and it was more of a shush and get it out the door type thing.
After my first few months of college, I was home, I was driving around with my mom running errands, and she asked me if I'd met anybody interesting. And she was strangely keeping things very gender neutral. And I remember saying to her, yeah, there's a few interesting people. And she said, is there anyone you want to date or bring home? And I said, there might be 1 or 2 out there. And she looks at me and she says, I just want you to be happy, and I want you to bring home a nice girl or a nice guy.
Coming out was a shit show. I don't know if I can say that, but it was a shit show. And I came out in college, not even that long ago. But when I came out, marriage was not legal. So now it's a big difference, and I think it makes a difference to kids. And for me, I came out in the context of a sorority, actually. And it was a very conservative situation. And I was dating a fellow sister, and it was really bad. It was not a pleasant environment to come out in.
When it came to college, I was my own person. I was on my own. I was living with roommates and had people that I knew and that I appreciated from the day I started in college. And those are people who just were open about everything. They didn't have a problem with someone saying they were interested in a guy if they were a guy. They didn't have that hang-up that some people did. And I found that fascinating. So I explored it, and I would ask friends, what do you think of that guy? Because I think he's very handsome. And they would say, oh, I think he's handsome too. You should date him.
I was pushed out of the closet, or I came out, and then I left, and I traveled for 9 months, and then I came back to New York, and I was ready to hit the ground running and be as gay as possible. And that is exactly what I've done. And so everything that I do is gay now. My work, my whole world.
You know, I think we all want to kind of control how we appear to other people, and to have to transition and have to let go of that and let people make their own decisions about you and possibly talk about you and judge you and become uncomfortable when you go into their bathroom. It's really, letting go of all that was extremely difficult, but also super freeing once it happened.
Finally, I was exactly right where I was supposed to be. Was like, thank God, okay, this is gonna happen. And then it did, and then I was like, and I love you. And I can never leave you. And I married her, and I'm still married to her. That's what happened when I finally got laid. I was like, okay, don't go, don't ever leave.
The most important thing to me is that I waited till I was 34. And everything happens when it's supposed to, but there is no reason to wait to be who you are.
Aww. I want to continue the discussion around how do you make, and I'm going to turn to this side, the environment safe and accepting for LGBTQ patients or clients that you work with. If you could just talk about that, that would be really great.
Sure, yeah. I think Tom had a lot of good points in therapy, right? It starts right from the beginning. I don't self-disclose very often in therapy. That's not my therapeutic style, but I almost always tell people that I'm bisexual or queer because I do think it makes a difference to model that behavior and model that openness and say, like, hey, I don't know you and you don't know me and you're about to tell me a lot of your secrets, so you deserve this piece of me, right? Like, you deserve this safety that I'm going to model for you. And I also think it matters because they know, like, I get it, right? I lived in the deep South. I went to a very religious, he's laughing because he's from Georgia. I went to a very religious undergraduate school that was not accepting at all. So like saying, like it says so much in creating a space by just being who you are and bringing that to the table, right? And I think having the courage to do that and having the like ability really to say like, hey, I'm coming at a position of power as someone who is a provider, as someone who is, you know, making decisions about someone else's healthcare and saying like, I'm going to model this behavior for you and I'm going to break down that power dynamic is huge.
Great, thanks. And older adults, because we have, for us older adults, right?
Yeah, well, I was, just reflecting on all of those diverse coming out stories, and so many of them were just so heartwarming, but there were some heartbreaking examples too. But even in those, just hearing the resilience and the pride that people have, going through their lives with coming to terms with that. But I think it's really important to recognize that, older adults may have experienced, more rejection and even more discrimination than people today. And, we were talking about conversion therapy earlier, and, being gay was illegal, and being gay was a psychiatric diagnosis until 1973, so not so long ago, right?
Yeah.
So there's just a lot of, things to acknowledge about what older adults who were gay were going through when they were first coming out, and and some really negative interactions with the health care system and mental health care system. So there's a lot of reasons that, older LGBT individuals have to distrust the healthcare system. And so we have a lot of work to do to make a more accepting, inclusive environment.
How about?
I'm unapologetically queer. So one of the ways that I suppose I create some of that space for folks is by showing up that way every day. I focus really strongly on values when I work with my team. I was just in a huddle with our administrators, and we talked about the importance of our values and who we are as an organization and as individuals, and how part of that is service. Right? I'm a servant leader, and I believe in service, period, right? And so creating that psychological safety, that space where we're able to no matter what, right? It doesn't matter what you believe in that space. If your value aligns with this, then you are creating a space that's right for people to be in. If we can start there, I'll work on the rest of it with you. But using the right pronouns is extremely important. I work with teams that are at front desks, that are answering phones, and we've got to make sure that we are creating that immediate connection where people know they're using the right language. This is a space where I can come in and feel psychologically safe in order to do the meaning-making work that I'm here to do, right? That I can come in and love myself and develop my identity in this space.
That's great. What I tell case managers and providers too sometimes is, let's set aside the electronic health record or the claim system or whatever you're looking at. Listen to what the person says, how they identify, and what their name is. I don't care what's in the system. Let's be patient-centered or client-centered and listen to what they, how they call themselves, how they refer to themselves. Looking at this panel, I'm realizing there's a little bit of diversity, but not a lot of diversity. I want to talk a little bit about intersectionality, because we know in this country, for example, transgender women of color are the most vulnerable, some of the most vulnerable people in this country in terms of suicidality and domestic violence and so forth. So talk to me a little bit about, in your practice, I'll turn to you, and in terms of how you work with clients who are intersectional in terms of race or ability status, veteran status, and so forth.
Absolutely. I think it starts with the way that we educate providers, making sure that it's part of the curriculums and the experiences that we have in undergraduate and graduate school and in professional internships, making sure that people are learning about cultural competency and cultural humility. So I think there's that piece of it, the educating providers, and then the other side to it is making sure that our workforces are as diverse as our clientele. And that also starts from the very beginning, making sure that our schools are accessible to a wide range of folks, making sure that they're safe spaces, affordable spaces, from school all the way up to employment.
Great, thanks. You want to take a crack at it, or go ahead?
Yeah, I think there are a lot of different ways to like develop the workforce. I really, kind of respond to that. Like, how do we broaden the workforce to make, more acceptable kind of services? And I think we can go beyond traditional healthcare systems and look to community-based organizations like, in my work, senior centers or other aging care centers, and kind of like developing like a peer-led workforce. There's just so much, promise in that kind of work, and like, training up peers to deliver evidence-based interventions so that people feel comfortable seeing a peer, somebody just like them, but that can help them kind of manage any mental health issues that they may be experiencing. Maybe not the more severe ones, but really common or milder forms of depression or anxiety.
Do we have a question?
We have a couple of questions. This one I think is really directed to Liz probably, which is, how would you recommend finding a therapy to discuss religious trauma? I am bisexual and Christian, which felt disallowed, but I realize I can be myself and heal.
Easy, right?
Right, yeah, it's just only 5 questions. Yes. So first of all, I'm really glad that you're asking the question, right? Because I think that having the courage to start is really, really difficult, especially if we're brought up with these schemas that tell us that we can't be who we are and that innately that is bad, right? So starting kind of that out of the way, to find a therapist, I think really consider what you want in a safe space and what makes a space safe for you, right? So do you want a provider who is also bisexual? Do you want a provider who comes from a Christian background? Do you want a provider who doesn't have a religion? Like, what would feel safe for you and what would be triggering for you? And reflect on that for a bit, right? And once you have kind of an idea of what that would look like for you, then think about what your goals are. Like, who do you want to be? What areas do you want to work on? Like, what would you want modeled in a therapeutic relationship? And then, Psychology Today is a really great resource to look for people. So you can search by your insurance, you can search by sexuality, you can search by gender identity, and then you can kind of filter through. And I would recommend like interviewing a number of therapists, because it's really comfortable, really important that you have a comfortable space, and not being afraid to say like, hey, you're not showing up how I need you to. That's okay. We just aren't compatible, right? And not being afraid to, take time to put in the work. I know it is a long time and can feel really daunting, but if you have that safe therapeutic space, it's really, really worth it in the end.
Thank you. With anti-LGBT animus on the rise, how do we connect support and services to people in rural parts of Washington state and who might live in less accepting places?
Well, I think one of the great things to come out of the pandemic is increased access to telehealth. And that's something that we need to protect and continue to support. Some states are taking steps back, starting to limit access to telehealth. Some insurance providers are doing the same. But it's a really important way that we reach people across the state and across the nation. So the therapists in our group practice all operate out of Seattle, but we have clients all over the state of Washington. And we really just couldn't do that without telehealth. And I think it's becoming increasingly important too, as the LGBT community is starting to spread out more and more. So part of that is a good thing, it's progress. LGBTQ people are safer in more parts of the country than they used to be. But it also means that we're not centered around neighborhoods like Seattle's Capitol Hill. And so we really need to make sure that we have telehealth in place, supported, protected for the long term, not just for the pandemic.
I think there's also a lot of, you mentioned Psychology Today, there's the Gay and Lesbian Medical Association has a provider directory, OutCare has a provider directory. In Washington State, we have this great website called multiculturalcounselorswa.org. These are all self-attestations around being inclusive, and which is a first step. You mentioned cultural competency. I think because we don't have enough behavioral health providers around, making sure that there's an ability to educate straight allies through cultural competency and working with LGBTQ patients as well. So the other piece I would say about telehealth is there are some research that shows that there's different preferences around what people want from telehealth. For example, a study just came out that Black patients preferred audio interaction as opposed to use of apps for their healthcare experience, and there's differences in gender and so forth. So I'm speaking to my employer colleagues here to saying, just because you have one methodology for virtual care, that may not meet the needs of everyone. They might have different preferences, and particularly in rural areas. I'm from very rural Eastern Washington. You also have broadband considerations as well that need to be looked at. So anyway, you have another question?
I do. We'll do this one, and then we'll go to our final clip. So as health professionals, have you ever had to advocate for children or underage people when their parents or guardians are not supportive of who they are?
Yeah, I can do this one. Just like look at.
It's on you.
Yeah. I do see some children. I see children specifically who have like LGBTQ identities and are like kind of figuring that out. Advocating for them with their parents is really difficult, honestly, because, I mean, ultimately, like I'm not their parent, and ultimately, like their parents do have a lot of ability to make their lives better or worse, right? So I found that most parents, especially parents who are willing to put their kids in therapy, want to come to me because they have questions, right? They're learning. They are open-minded generally, right? If they're coming to me, obviously they've taken a step to help their kids. And so I find that giving the children the language to use, giving them the tools to communicate, talking about like, okay, what would you want your parent to know? How would that look for you? What kind of things do you want in your healthcare? And then bringing the parent in and kind of just like guiding the interaction and being there to support the kid can be really helpful. And also sometimes the kid just doesn't have any way to discuss what's going on with them. So having them there while I'm having a conversation with their parent, and their parent is asking me questions about it, their parent is asking me like what to expect, or like if I can refer them to any other services, and they always have the option to be like, hey, actually this is what I'd want, and giving them the power and the support from an outside source, someone who's in a position of power as a provider, can be hugely influential in just allowing them and their parent to have a space to like ask questions and learn and grow together and figure out what a safe space looks like for them in their home.
Thanks.
Just a quick comment. Many resources are being mentioned here, right? And we've already started a webpage with resources. We'll add to that. And on Monday or Tuesday, you can look for an email with a link to that. We'll also be providing a link that will be live for 2 weeks to the full viewing of the film. And yeah. So those are some questions I've been getting. So thank you.
Great. We ready for the next clip? Great, thanks.
Am I in love right now? Not necessarily.
Yes.
Not currently, no.
Currently, right? Yes, I am.
I am so in love right now.
Yeah.
Valentine's Day is coming up, but yeah, I am not in love with anybody at the moment.
Me and my husband have been married for 32 years.
I'm getting over 2 relationships right now.
I love him so much. Just thinking about him can make me cry.
I don't believe in relationships. Probably never will.
And am I in love right now? I am, with my partner for 21 years.
I would really love to think that I was able to fall in love with somebody regardless of how I labeled myself or how they labeled themselves.
Married 4 years ago. I met him on the street, and I just asked him out.
I see love as for everything and not just like in terms of relationship.
I think I look for a very strong complementary friendship, like a partnership one where you can grow and support each other.
I think that I'm attracted to a soul.
I would like to think that if I fell in love with a man, I would be comfortable enough with myself to say, I fell in love with this person. That's it.
It's about the connection, the love, like how we are together. That's all that really matters.
Most pain that people feel around their gender identification or around their sexual pleasure identification has to do with not being able to be the biologic person that they are. And I find that these are the people that will come to therapy because they're in terrible pain.
His dad was not okay with it when he first found out, and he called me one night and said, I'm not okay with this. And I said, well, you really need to be okay with this, whether you like it or not. You really need to accept that this is who your son is. And I said, you know what? A lot of kids his age, especially boys, commit suicide because they're not accepted, especially by their parents. So I said, you better find a way to be okay with it.
I don't understand a parent who can turn their back on a child once they find out they're gay. I can't understand a parent who can't sense it, who doesn't see it, recognize it. And I just can't imagine what a child must go through when their parent rejects them. I just can't fathom what that must be like.
I started drinking and doing lots of drugs and became very destructive, and I did try to kill myself. I just tried to end it because I kept doing things that I didn't love about myself and just kept really separating from who I was. And then I sobered up. I'm 7 years sober, and then transitioned. And I feel like I'm in a time in my life where I'm figuring out who I am and falling in love with myself and doing respectable acts to myself so that that love can be there a little more.
I have an identical twin brother, and today I would say he's one of my greatest allies when it comes to being gay and being an activist and being exactly who I am. But growing up, he was one of my biggest bullies. I see character flaws in him that make me wonder about myself. And I think growing up then, when he knew that I was gay, he saw something maybe in himself or was afraid that there might be something that was different and not okay with himself. And that became antagonistic.
I'm very concerned about the high rate of homelessness among the LGBT population. 40% of the youth homeless are LGBT. We're hardly 40% of the population.
My work at the Los Angeles LGBT Center is super cool. We're the biggest LGBT organization on the planet, and we save homeless youth, and we have housing for homeless youth and seniors, and we have all kinds of programs and transgender programs, and it's an amazing place. It's almost a $90 million organization, and we're about to build a huge campus where we can house more people who get them off the streets. And we have, of all the homeless youth on the street at any night in Los Angeles, 40% are gay or LGBT, and mostly because they've been thrown out of their houses.
So it's not easy. There's a lot of family discord that comes about it. People used to hide these things in the past. Now it's all out in the open.
Today, I think we have a new set of issues because things are more out in the open. So, you know, I see I work with a lot of transgender people. I see the struggles that they have not getting beaten up on the street at night. I think probably when we weren't talking about it as much, people could hide a little bit more. I love that we can talk about it. I love that people have role models now and people they can go to. And that's very positive. It's just that now we have to figure out how to keep people safer.
Which has been really interesting, getting friend requests on Facebook, especially of young girls saying, we don't have role models, we don't have anyone that represents us. And I have a lot of questions. And one recently had friended me and said, can I talk to you? And I said, yes. And she said, I will when I feel safe. I said, I understand that, honey. I just know that it's always safe with me. You can ask me anything. And she said, I think I'm gay, but I don't know, and I'm scared. And I said, don't be scared. It's okay. And maybe, you know, as you're young, as you learn, maybe you're not, maybe you're bisexual, maybe you are. It's okay, whichever. Well, come to find out, her fear was she lives in Dubai, where it's illegal to be gay. And to be able to say something out loud, or even in just a message, was a big deal for her.
When I first had a word for what I was probably 11 years old. I was in the bathroom listening to Madonna, and I saw myself in the mirror and I said, I'm gay. And in that moment, it was relief, but it was also kind of devastating because the narrative in the Ozarks where I grew up was basically if you were gay, you would get AIDS and you would die. Mm-hmm. And in that moment, I accepted that as my fate.
I think people in that era were too afraid to admit to be gay or to admit to have interest in same-gender relationships because AIDS was associated with same-gender relationships. And that meant that they didn't want people to fear them.
I didn't know that I could be married and have a goal for later in life.
Have children.
Mm-hmm. Have children. I gave up on all of that. And when I got out of the Ozarks and I started opening my eyes, and then I had points of reference, and I saw gay couples that were together 20, 30 years. They had kids. They were living the American dream.
There's a kid somewhere right now in
the middle of the country who doesn't know a grown-up person who says that they're identifies as gay.
The many ways that I have seen the entertainment industry help that exact cause, and really break down barriers, open people's eyes by, for lack of a better word, normalizing, really blur and make things more fluid.
I think that America's moved forward really because culturally, gay became in the zeitgeist, it became acceptable, and suddenly you were seeing people on television that were gay, that were lesbian. Now you're seeing transgender, which is so great, and you've seen that change the politics.
Well, I always admired people like Ellen and Roseanne and people who were doing those shows that nobody was doing at the time, who were introducing characters in a way that felt like this is a family, this is a normal family, And so for me, in the corporate world or other worlds where I needed to come out in a way, it felt a little bit safer for me because those things were happening in the media. So going back to role models, sometimes those were people that I looked up to go, thank you for having two women kiss or having two men kiss.
It never, ever would have happened without things like Will and Grace, you know what I mean? L Word, things like that were really helpful. Even going back to the 70s, there was this soap opera that I forgot, it was a gay man was on it. I think Billy Crystal played the gay guy. And that started changing the society and culture because, you see somebody on TV and you feel like they're your friend. So if that person is gay or lesbian or Black or Hispanic or something other than what you are, it definitely moves you in a place of knowledge, of safety.
If you feel something and you are something and you don't see it anywhere else, then you feel lost and alone.
I met and became acquainted with all these actors, these different celebrities who were completely closeted in their public lives. And I kind of was learning that that might be the way for the LGBT community, to keep certain things private as one builds their own brand as who this public persona is, yet they have to hide parts of who they are. And I was very much conflicted by that.
I was still coming to terms with my sexuality. I met up with a producer by the name of Alan Parker, and when I finally told him that I was gay and that this older white gentleman is my partner, he said, that's great. He said, now we can make music. You can put that into your music.
Nowadays, I don't hide it. It's part of me, and it's part of what I bring to the table.
And I never thought about that. I was always scared because as a rapper, they always say that, there's no room for homosexuality. And Alan was telling me, no, do it, go against the grain. Let's push some boundaries.
I hope that kids will sort of see that there's different avenues to take a lot sooner than I was able to.
Those kids that probably have gay people around them, but they're too scared to come out or oppressed or whatever they're going through, they see the people in TV and in movies. And that's why I think it's so important for anybody who has any kind of fluidity in their sexuality to say it. Because you're literally saving a life, literally saving lives.
Wow, that was powerful.
Hmm.
I'm going to do a little bit of a pivot, and remembering the Washington Health Alliance is a multi-stakeholder organization. I want to get your input on what can employers do. I'm going to ask about several stakeholders. What can employers do to make the workplace more inclusive for LGBTQ individuals?
Can I jump in even though I'm not a doctor?
Sure.
What I heard in this clip was about people being authentic, and no matter what you do, you're better at it if you're not charading and you're not changing your pronouns and you're not pretending to be somebody else. So when we give people that permission to be diverse, diversity breeds innovation.
Yeah.
So if people get that freedom, companies don't have, 1,000 employees that think the same way. They have 1,000 employees that bring different things to the table. And I think as an employers and in healthcare, if we keep pushing those safe spaces and keep making it okay for people to be who they are, we'll have a better environment and world.
Totally agree. I actually refuse to talk about what's the business case for diversity. Either you believe in it or you don't. I'm not going to talk about the business case. Just not. Like, you either believe in it and it's a value, or it's not. And totally, there's been lots of research to show that companies that are diverse are better top line, bottom line, more successful product development. When you have a workforce that reflects the consumers or constituents that you serve, you thrive as a business. So either you get it or you don't. Yeah. Any other thoughts about what employers can do?
There's a piece of what you said, it's actually from Jill, you and Michael, this idea of authenticity and diversity, right? And we need to be authentic about why we want diversity. It's not just about the business line, right? It's not just for the business purpose. It's because you're talking about human beings, and in the lack of diversity, what do you have, right? Are you doing diversity because it makes you feel good about things, because it's what you're told you need to be doing right now, or are you doing it because it's your core value? Right? And people can see the difference. Right? They can feel it when they work in a place where it's because you want me to show up and you want me to add my authenticity, right? So diversity for diversity's sake, to make some folks that are uncomfortable feel better about things, is never the right choice, right? But diversity because it's the right thing to do, because it's where we need to be, right, is the important context for that conversation.
Agreed.
I think, you know, Jill, you're kind of alluding to it, like, employers can have HR systems that allow people to put in, what's my preferred name? What's my gender identity? And if it's gender non-binary, then let me do that. These sound like, or, you know, have gender neutral bathrooms. I mean, there's a lot of really practical things that employers can do. But to your point, it's got to be authentic. Absolutely got to be authentic.
Well, there's a piece to that too, right? The idea that if I'm going to add that into my systems, that makes great sense. I love that. We need every single bit of that, right? But we also need to make sure that our policies and procedures, our onboarding, supports people that might walk into this space ignorant and not realize what any of that means. So that they can learn and have the opportunity to learn before they're around other folks, right? Because that mistake in that workspace, walking up to someone and being like, what the heck is a pronoun? Right? I'm sorry, what? You know, it's like, well, first of all, let's have an English lesson, you know, but it's, you know, but like, that shouldn't happen. So if you're going to do those things, you need to also make sure that you've planned through every single step of what that means. It's your DNA as an organization, right?
The whole learning and development approach. And there's also ways for employers to test that. So the Human Rights Campaign has the Corporate Equality Index, the Healthcare Equality Index for healthcare systems, I mean, municipality. It's a very comprehensive set of criteria. So for different employers here, we were just talking about the Long-Term Care Equality Index too, for long-term care facilities, skilled nursing facilities, assisted living facilities. And it's a great way for employers to do kind of a self-awareness, I think, about how are we, policies and procedures, benefits, representation, do we have an employee resource group, all those kinds of things. So let me pivot, if I could, to health plans. I assume you, two of you, and by proxy for you as administrator, work with health insurance carriers. What can they do to make life for LGBTQ patients better, easier?
So much. I mean, there's a long road to go, if we're being honest. I mean, at the beginning with pronouns, so like in my practice, we leave that open-ended. What are your pronouns? There's no boxes to check. There's not a binary option. But then when we go to submit an insurance claim, we have a binary option. And we have to gather that information from our clients. And so that makes it hard for us to be a safe and affirming space and safe affirming providers. But more importantly are some of the procedures that are covered and what that process is like. So gender affirming care, especially gender affirming surgeries, are very difficult to access. Right now, most often, a gender affirming surgery requires a letter from a mental health provider. And it just should not be the case. If you want to make a decision about your body, that is your choice and your choice only. It's also a medical necessity and something that should be covered by insurance plans and easy to access without the need for letters.
Absolutely. And I think the justification for mental health care and the justification for like gender affirming surgery, we recently had a client that we were discussing in a consult. Their insurance provider said that it wasn't a medical necessity that they got the surgery, right? And redefining what that means, right? It is suicide prevention to provide these surgeries, to provide these services. That's baseline medical necessity to keep someone alive, right? And deciding what your healthcare system looks like what your health plan means, and really opening the space to people who aren't like you and listening to what they say, right? Because so often we'll look at it and say like, oh, we have 5 checkboxes for pronouns, that's enough, right? But that can still feel like somebody's getting pushed under the rug. That can still feel like, we're jumping through all these hoops. Having really transparent procedures for what people need to do if they want gender affirming care, if they want hormone replacement therapy. So many clients I've talked to will write, 3 or 4 letters because they want specific criteria in the letters, and they don't tell you until after you submit them, right? And I mean, if people can afford to go to a therapist, which is, even a different bracket, then they have to jump through multiple hoops and continue to prove that they deserve the care when that's been largely their whole life, is proving that they deserve to exist in who they are.
How about Medicaid managed care organization?
That last moment wow. So for me, it's this idea of every decision you make in a boardroom can lead to more trauma for the human that's standing in front of us, right? We have to be careful. We have to remember the people that are behind all of this and all these decisions that are being made, right? This person's already walked through with enough trauma in their life. Don't put us in a position where we have to build an electronic health record that's trying to support what we need to do for the insurance piece of this, right? Which is important. We need to be able to do this. We need to be able to pay our bills too, right? This is all very important. But I also have a person standing in front of me that I have to only see their legal name because of the way this is built, right? Their legal name, whatever that is, right? So we have to be mindful of the changes that need to take place to move away from these binaries and the sense of what is normal, right? And we have to make sure that we're making something that is diverse and inclusive and allows people to be authentic. And it's, for me, I think immediately about the fact that the first time someone walks into one of our sites, who do they talk to? It's one of my front desk folks. You're not helping me give them the tools that they need to succeed at making that person feel safe, to succeed at helping that person be able to leave some of that felt stigma at the door as they walk through and feel like, wow, I can be my authentic self here, right? We need that help.
Nice. Well, one of the things that might be helpful in terms of what the requirements are for gender-affirming treatment is the clinical guidelines in the World Professional Association for Transgender Health Standards of Care, mouthfuls, WPATH Standards of Care. I have it on my desk right there, dog-eared. It's 10 years old now, and it's in the process of being updated. And so we're all waiting with bated breath to see, because I do a lot of my work in my day job around that, and my colleagues are like, when are the guidelines going to come out? It's like, I'm not in charge of them. They're going to come out any day now. So hopefully some of these requirements will be changing, and usually the insurance carriers follow along with that. How about what can other healthcare providers do? Primary care physicians and other healthcare providers, what can they do to make it better for LGBTQ patients or clients? Thoughts?
Well, I think that everyone needs to educate themselves first of all, right? That's the first step. They need to get comfortable asking more questions and creating that safe environment and making it routine. It's just what we ask everybody. Love to hear from you. And using more shared decision-making kinds of strategies to involve individuals more so in making decisions about their care. What are the options for me here? What are the pros and cons for me? What are my values? And respecting that rather than just giving a prescription or saying this is what you should be doing.
Great. Any other thoughts about what other healthcare providers can do? Go ahead.
Oh, I don't have it. Sorry.
I think part of it is what we're doing right now, collaboration,
Right.
and making sure that we have good referral networks. Like the story that I shared before, we need to make sure that we're referring people to providers that are safe. And so that means consistently updating lists and checking in with our clients and our patients, asking them about what their experiences are as they're working with different providers.
I have a question. Patrick, maybe you could comment on, as we're talking about primary care and that model changing, right? And how that can be more supportive.
Yeah, so the majority of people who have mental health issues like depression or anxiety do not go see a specialist like a psychologist or a social worker or a psychiatrist. They tend to present in primary care or other healthcare settings, which traditionally, have only dealt with medical issues and not, talked about mental health concerns. So there are certain models that can integrate mental health care within the primary care setting. And so first step is just to do universal screening and, use some standardized measures to pick up elevated depression or anxiety. That's not enough, of course, then having the services available, because we know if we refer somebody out to see a specialist, the majority of people, not just older adults, but any adult is not going to follow through. So if we can kind of embed mental health services in primary care settings, we know that we've gone a long way as far as increasing access to effective treatment options.
I actually also want to send out maybe a challenge for the Alliance and for the members of the Alliance, because the Alliance does such great work, great reporting, really helpful to find out what is the quality of healthcare in the state. And I think it's really important to start getting more demographics into databases so that we can see not just how many preventive screenings are being done, but how about for mammograms for Black women or colorectal screenings for LGBTQ individuals or what have you. And I talk to employers about this, and typically human resources departments have race and ethnicity voluntarily collected on a self-identified basis at the time someone starts work. So bringing in race and ethnicity into the Alliance's reports, and then ultimately also sexual orientation and gender identity, or so-called SOGI data, and disability data, and veterans data, and having maybe a multi-year work plan of how can we get there so that we can look not just how many women get mammograms, but gay Black women between 40 and 45, or whatever the demographic is. And I know that's an aspirational goal, I realize that, but I think in order to really improve health equity, we have to start by knowing where we're at today in terms of health disparities. And we don't have the tools yet in healthcare data to know where we're at. Also, I think another thing that we can do, I guess, in behavioral health is get more valid quality measures. You may know more than I do. Like, we have so few, I think the National Quality Forum has 2, like hospital readmission rates and use of medication-assisted treatment for opioid use disorder. That's it, in terms of validated quality measures. And we just don't have enough quality measures. And so, like, screening rates for depression or anxiety or whatever, we just need to get more of those measures in behavioral health out there so we can see how well are we doing. And then through the lens of different demographics.
Over time, and not just picking up need, but also measuring over time to see, is what we're doing, is that working, or do we need to intensify or think of other options?
Yes, because my sense is when providers get information about quality measures, they address it, whether it's primary care or behavioral health, and the same with health plans. If you have data that shows, here's some gaps or things you need to improve, they go after it. There's an initiative and they work on it. But without the data, then we don't know where we're at and where we need to be and how to improve. So I think that's just a long-term. I would just throw that out to the Alliance. I don't know if you're ever going to have me back, but that we got to have this demographic data into our data reports to see where we are today and how can we make improvements, and are we making improvements? So anyway, I'll get off my soapbox. Do we have another question?
Are we going to have you back? We're going to bring you to the table. That's what we'll do. What are your thoughts about how we train our physicians to become safe sources of care from the time they are in medical school.
Yeah. I have a lot of thoughts about this.
Go for it.
So, kind of part of my background, I have a bachelor's degree in biochemistry and was planning to go to medical school for psychiatry. So, I've done some, self-reflection around what that would look like for me and why I didn't decide to pursue that route. I think that a lot of times the medical profession, even, up here with the privilege to sit up here today in front of you or with a master's degree, is something that's only barred for people of a certain economic class, of a certain, race, of a certain sexual identity, and realizing that that's, a privilege, and realizing that that's also not often the people that we're serving who need help, right? And realizing that ingrained in all of our systems are heteronormativities, racism, and really taking the time to introspect and saying if I want to be a provider, if I want to be a mental health provider, that requires that I ask myself the hard questions. And we're kind of stepping into a space with our clients or patients or whatever that is, where it's a forced vulnerability for them, right? We're asking them okay, what is your gender? What are your pronouns? What is your sexual identity? What is your trauma, right? And you should be willing and able to answer those questions for yourself and to see how these systems that we're all in, that we're all a part of, that we have to be a part of, have influenced you in something that is so gate-kept, right? We're in a position of power, so really think about how you're using that and think about you were trained a certain way. Is that something you want to continue, or how can you adjust it, and what does that mean for you?
I think there's also some resources that I'm aware of for physicians and other healthcare professionals, like the Fenway Institute out of Boston has some great, for physicians and other healthcare providers, has some great trainings. There's also some textbooks now that are coming out for physicians and nurses and social workers and other healthcare professionals to just bring that awareness around LGBTQ issues. The other thing that I would say is, we've talked a lot about providers self-identifying, but there's also cultural competency. And I was really struck by one time I was doing actually an open enrollment session specifically for LGBTQ employees, which was really great. So we got some questions from their employee resource group, and I came up with some questions, which I'm always full of questions, full of whatever. And we first went to the insurance carriers and said, okay, here we want, and they came back with a generic thing, and I said, well, no, you didn't answer the questions. This is not your grandparents' open enrollment. We want to know about PrEP coverage. We want to know about, does the AAP offer help where someone has survived a hate crime and so forth. Anyway, this medical director from a health plan got up and said, I'm a gay man, but I am not competent to take care of a transgender patient. And that really struck me, of that difference between identifying the community and having the competency to take care of a trans individual going through gender affirmation treatment is very complex and clinically technical, if you would. And so I thought that was just really powerful to make sure that we understand the difference. And there may be LGBTQ patients that you don't feel competent, if they come to you, I think there also has to be some self-reflection. I think you said it about what do you feel comfortable handling, and then knowing where to refer, to your point as well. Right. You look like you're...
There's a Q at the end of LGBTQ. And for me, there's this transition that we see happening where we went from a stasis of this heteronormativity, right? There's a bit of homonormativity that's happening right now, where it's white picket fence for the gay white couple that wants to adopt the children, that, right? That's not everybody. Right? And so I think sometimes what we see happening is people begin to learn, and thank you, don't ever stop, right? But you need to keep challenging that, right? Homonormativity is also not it.
Right.
There's a Q. It's queering it, right? It's recognizing that there's more beyond that, right? It's recognizing that there's something beyond that idea, that there are some of us that don't just say they, them, or he, there's a
spectrum.
Yeah.
Wasn't even trying to tie this into this, and it's happening, right? Well done, Jill. That there's a spectrum involved in this, and I say for myself, earlier in my understanding of my identity, I had to move beyond that idea that I had to be stuck in this gay mold, because within that I never felt welcome within the community. I've never been a gay man, right? I just haven't. And it never felt right. And that's a challenging space for folks, even when they do know something about this, right? But it's recognizing that there is so much more that we need to be talking about. We're getting there. It's exciting. Thanks. Go a little faster, please.
I also think it's so important to recognize, like, do you know about the culture or are you in the culture, right? And I think this is something that's so important to my practice personally and like any provider that I'm going to see, because it's, you know, LGBTQ topics are really hot button issues now, and like we're going to Pride and it's fun and that's great. And also there's just this deep seated sense of like self and sense of like, well, do you understand what it really means to be like not a fair weather ally, right? Like, do you understand what it means to actually be like queer in somewhere that's not accepting, or is it just fun because it's in Seattle, right? Like you said, I'm glad we're having these conversations. I'm glad to be celebrated, but I think that recognizing that cultural competence doesn't mean that you're going to understand someone. And if you're expecting them to explain their position to you, maybe you're not the provider for them, because they're coming to you as someone who's going to provide an outside perspective, not to educate you, right?
Really good point. And I would also just piggyback onto what you were saying. But sometimes I hear employers go, well, we looked at our gender affirmation treatment coverage, so check, we have LGBTQ inclusive care. Right. And all we've looked at is gender affirmation treatment. Important, but there's other things. And for example, I just encountered a health plan that required 2 levels of prior authorization for PrEP. Like, what? 2 levels of PrEP? So, I mean, do they do that for any other preventive screening service? And so we had that conversation, and so we're working on, so there's other things other than gender-affirming treatment, or, you know, we know that there are low levels of preventive screenings for LGBTQ individuals. And so how can we tailor our communication, right? Whether it's sexual orientation, gender identity, race, whatever it is, to make it more meaningful for an individual, so it speaks to them as their community. And having generic communication just doesn't cut it. So,
well, it's just that idea of the intersectionality of these things, right? Pride's happening, yay!
Yay.
But it didn't start with a bunch of white guys dancing around. No. It started with transgender folks throwing stones and bricks and fists and tears and trauma. And, you know, I mean, we need to remember that this started as a protest in a group that we often skate past real quick and just sort of be like, and don't get me wrong, I love Ellen. I loved it when she came out on TV, and I was thrilled as a teenager going, yes, thank you. You know, but like, we can't forget that, right? There's a whole community, and it's like, when I go to Pride, I'm there to protest. I'm there to remember that our transgender loves in our life are still fighting for like the right to be recognized as a human being, you know?
And to get health care.
That is twisted, right? We need to make sure that we remember those things, right? We need to celebrate the beauty that is this community, but we also need to remember that we all rise together, right? Yeah. And just because we've got marriage equality going and this here and this, that, we're not done, right? And the people that started this battle still need us.
I'm just reflecting, someone made a comment once that, you know, with Pride posters, you many times see drag queens and or shirtless men, and said, one day I want to see a Pride poster with a middle-aged lesbian couple paying their taxes. You know, like, you know, that's what we're you know, we're employed, we're paying our taxes, you know, and there's a full range. It's not to take anything away from drag queens or shirtless men, but
please don't.
But I mean, like, just, you know, we're tax-paying citizens and contributing to society and all those kinds of things. So anyway, I'm pointing to you if you have any more questions. I feel like I'm not allowing you to ask questions here.
No, you're good. This is all good. There's some questions for Jill. So if we just pivot a moment.
Put her on the hot seat.
You know, we're covering an intense topic, so maybe it's time for maybe a little bit
a little levity.
Yeah.
How'd you go about choosing the people that you interviewed? How'd you recruit them?
excuse me, it was organic. I started a Facebook page and said I wanted to make this film, and people just kept bringing me stories, which was amazing. People are like, oh, you got to meet this couple. They've been together for 40 years, and they're just wonderful. And people like flew themselves in to be in the film from California and Texas, and it was just wonderful that there were so many love stories out there, and people trusted me with their stories to share it.
Did you interview people who noted they had been openly homophobic at some point? And how did that go?
I did not. I didn't. And okay, my goal was to interview 50 souls. It was sort of my riff on 50 Shades of Gay. So I sat down with 36 people for the interviews, and all the other people that did the commercial breaks, that's sort of my advertising background, to just break it up a little bit. And those people, there was no parameter on who they were. The producers just got people in for questions. So they could have been homophobic, they could have been anything, but I didn't really get any of that. The New York Times picked up the film on the day of its digital release, and the title of the article was "How Gay Are You?" So that was like the commercial break, which was like my favorite part of the movie, because nobody said zero. Nobody said zero. And then like people are like, well, I'm in a relationship, so I guess I'm a 5. And I'm like, well, I don't know, you might be more than a 5 if you're in a relationship. And I love the 11.5 guy, but yeah. I didn't have any resistance. I didn't have any homophobic reactions, but I seriously had nobody who said they were 0 on the spectrum.
No other questions at this time.
It was so nice to be here, and this conversation started out so differently, and to have it spread out. And Denise and the Alliance, thank you so much, and all of you for being here to actually take it to this next level and to actually keep doing good with the film. And I couldn't be more proud today, so thank you for having me.
Thank you. And, as has been mentioned, it's Pride weekend, right? We have someone online who is proudly disabled and bisexual, and has expressed their dismay and frustration that they're unable to participate in Pride because of their disability. So, asking for us to take that into consideration too, right? That physical disability can exist within a person who's LGBTQ.
Yeah, this concept of intersectionality is really important. And although, we were focusing on sexual orientation and gender identity today, just understanding that and how do we communicate with people with vision loss and hearing loss and so forth. I just had a story, a colleague of mine told me that she was doing an assessment of a program, and the vendor was very proud that they had sent this Spanish-speaking man health education materials in Spanish. Isn't this great? She said, but your case notes say that he's blind. So how's that supposed to work? And so that's an example of, the first clip of it, putting people in boxes, and then, I talk about the example of, I talk to clients and frankly, other consultants that say, well, we put in a fertility vendor, so we've solved women's health issues. Like, wait, what? That's a family issue. If we want to address women's health issues, cardiac disease, cancer, musculoskeletal, not to say that fertility is not important, because it is. And by the way, family building is important to everybody, single people, right? LGBTQ people and so forth. So it does a disservice to us as human beings when we try to put people in boxes based on one demographic. It also makes it more difficult, more challenging. And certainly those of you that are doing therapy, like, you have to unravel the complexity of who your clients are. And not only, as we were talking about trauma with healthcare systems, but criminal justice systems and education systems and religious organizations and all those experiences that they bring to the table. So, and it makes it more difficult, right? But it also is a richer experience of who human beings are by looking at all those aspects. So I'm sorry for this individual that can't fully participate. And I think it's a great reminder for us of this concept of inclusivity has a lot of different meanings.
But on a positive note, they were part of today.
They were part of today. That's right. Yay. Yay.
Yeah, the social worker in me is always thinking about advocacy for folks in our community with intersectional identities. And we have a lot of work to do as a community. We achieved marriage equality for some, but we never achieved marriage equality for all in our community. Folks with disabilities are at risk of losing disability benefits when they get married. And so until we have that, we never truly have marriage equality. And so when we gain rights in part of our community, we need to make sure we carry that forward and keep pushing the bar and increasing access and benefits to all parts of our community.
Great point. Any other parting comments from other colleagues for today's discussion?
I'm just, that person is making me, in our discussion, is making me think about isolation and, just the negative, all the negative consequences of being isolated. It can cut us off from healthcare and mental health care, but it can cut us off from feeling a part of the LGBTQ community, and we have a lot of work to, telehealth is great and one good solution, but we have to think about other creative ways to help reduce the impact of isolation.
Any other insights? Parting comments?
Sure. I think that, the idea of putting people in boxes, like Tom said, right, it's a useful idea in theory for our life, right, to be able to assess something quickly. And I think it's uncomfortable to have those boxes broken. And I think it's uncomfortable to not know what to call someone, not know their pronoun, not know anything, right? But it's also exciting because look at all of the learning we can do. Look at all the inclusivity we can do. Look at the wonderful people that you get to know. Maybe some people you already know that you don't know this component of them, right? Like all these wonderful things we can explore. And if you'll approach it with curiosity, most people will meet that curiosity with excitement and like willingness to teach you and learn and like include you. Like we don't want to exclude people from the community. We want to include everyone, and we want that, incentive for people, like that excitement for people to come and explore. And if you're worried about being wrong or you're worried about being, making the wrong decision, like we'll tell you there's been a lot of wrong already, right? Like we're making steps forwards, and any step forward is progress.
Amen.
Any other parting comments from you?
Thank you for putting this movie together.
Thank you all
and
for
allowing us to be here to have this conversation.
Thank you for coming, everybody. Thanks for having me.
It's been great to hear this from folks. I only work with sound, and like hearing the other, I know other people are out there doing things, but it's so beautiful to see the passion that's up here in each of you, because I always say, like, I don't do the work that they do, but my role is to like make sure that they are able to do that sort of thing, because their passion and their art that they bring is necessary and important. So it just thrills me to see people thinking about this, and thank you for doing something about it too.
Nice.
And hopefully everyone goes away with all the stakeholders that the Alliance has participating: plans, plan sponsors, healthcare providers, health systems, health policy individuals, all have a role to play. All have a role to play. We're all in this together. Like you were saying, the whole community, all of us can own the initiative to make improvements and to be inclusive for all individuals, regardless of their demographics or because of their demographics. So thanks also to the Alliance and for all of the sponsors here too that have supported this work. Really grateful that you've done this, and I'm hoping the Alliance will continue this kind of dialogue and focusing on diversity, equity, and inclusion.
Here, here.
So thank you.
Thank you. Earlier, Jill had asked me what I had hoped to achieve today, what I had hoped we would reach by the end of this program. And I don't think I said this earlier, but first and foremost, that everyone walks out of here seeing themselves and others as the human beings that you are. We've got beautiful individuals in this room, and that you take it back to your workplaces and your communities, and that this discussion does not end here, right? We've got to keep this going. We can't create change if it stops here.
Well done. Thank you.
Thank you.
Thank you all.
Thank you to everyone. And for those of you here in the room, if you would like to share your reaction to this with Jill, we would love to capture you.
We have a
video.
camera up in there.
We
right?
do. We're ready to go. And she will meet you at the red carpet. So please don't hesitate to do that. And thank you to this panel, right? This has been wonderful.
Thank you.
Thank you.
Exactly.
You know, someone will watch this that, you know, maybe living at home, maybe struggling with that question themselves, struggling with their sexuality, not being able to talk to somebody, but they'll see someone like them represented in the film and draw strength from that.
I think it's important that we stop fighting over who people can love and who can get care.
Yeah, I love the conversation of like spectrum sexuality and gender and like including that in mental health care. I'm a clinical social worker, and in my like studies, I don't think that was like included enough, and it was really frustrating.
It's not just like drag queens and shirtless white gay men. Like the comment about the middle-aged lesbians doing taxes, I was like, oh, I feel represented. Thank you.
I've been questioning my sexuality and my gender for a while, and it was always hard to find a good label.
You know, some of these healthcare workers that have these big hearts, I feel like they're doing those small things that are going to make those changes. Maybe not world changes, but that's what I feel like they're touching those people that need them.
So I think the necessity of this film is that the fight is still there. We have to continue to fight and be represented and show up. And I think authentically being who you are in public to your friends, to your coworkers is part of that.
I loved how inclusive the film was with people who don't want labels or don't know what label fits. I think that's just amazing and like good to accept people that don't maybe don't have a name for it yet.